I have worked with the AMA, and can I actually acknowledge the AMA, how much support they provided to me in coming to an understanding about so many of these issues. Michael and all your predecessors, Fiona and yours. I have written an article for the doctor and spoken to some of the junior doctors about our commitment to supporting medical workforce training for new graduates at all levels in public hospitals. I think we're now expanding to private, to GP practice. We were talking about that while waiting to come in here. And also our desire to work with the colleges as we develop a workforce plan for the next 10 years, maybe 20, to determine exactly where the needs are so that we can focus on providing the resources in that area. It'll be a disaster if we wake up years down and find that we could have had an opportunity to address this now and we failed to do so. I think we've got to look at this long term. At the last election, I put out a policy about increasing GP proceduralists in country New South Wales to see if we couldn't start restoring some of the services at some of those smaller hospitals that have been cut. I don't know if you're aware here that 33 small country hospital maternity units out of 64 have been closed. And a lot of the skills of those GP proceduralists have now been lost, of course. So I worked with the Rural Doctors Association and others to come up with a proposal that we should reskill, start really focusing on getting those GP procedural skills up. The government mocked the idea and said, that'll take 10 years. I know, but if we don't start now, it'll never happen. And I think that's why we need to look long term and plan properly to make sure we get that those shortages covered.
Carl, is it?
Kyle Sheldrick, Chair of the Medical Students' Council. Just following on from what you just said, actually, about how we need to start now, it'll never happen. I note your calls in the last couple of days about what you call the immoral treatment of international medical students being excluded from the internships guarantee and the need for cooperation on a federal level. Given that some students are not guaranteed that will be graduating 9 months from now, what plans do you have in the short term to make sure that no medical student misses out on internship next year and possibly in the year following that?
Very good question. I've spoken with a number of the universities, most notably the Dean of Medicine at the University of Sydney about this topic. I do think it's morally wrong to accept money for full fee-paying international students and then not provide the capacity for them to actually finish their internship and go back to their countries as fully fledged doctors. So, but this is not just a state responsibility. The universities are accepting the fees. The Commonwealth is letting them come on their visas. I think it's a joint responsibility, and it's something that I'd put onto the COAG agenda immediately. Keep in mind that we'll be going to a COAG agreement July 1. It's the kind of thing that I think we need to put on the agenda there. In terms of what I can do, I'll do whatever I can do to make sure we accommodate all of those homegrown students, but where possible, facilitate international students. But finding the funding is going to be very difficult alone.
Hello, Jillian. I'm a pathologist, and this might be a voice from the wilderness, but I'm speaking as a pathologist for rural New South Wales. And what sort of measures would you take to try and attract pathologists to the disadvantaged majority in rural New South Wales?
Yes, we recognise that country New South Wales has been doing it tough. I can't force doctors, nurses or anyone else to go and practice, to live and practice in the country. But one of the things I can do is provide the money to upgrade the facility so they've got a decent place to work. And it's one of the reasons why this last 10 days I've been to Dubbo, Parkes, Forbes, Tamworth, Port Macquarie, Bega, Cooma and Wagga Wagga. And I chose those places because those are hot places where the Labor Party before the last election promised brand new hospitals, and not one of them's been delivered. And we've provided funding in our Fixing at Hospitals, which is our capital works program, $885 million new dollars, bringing a total to $3 billion to be invested in health infrastructure over the next 4 years. If we win, half of that money will go to country hospitals. And many working in them say to me, if you provide a decent place to work, it will help us to attract doctors. It won't be the answer to everything, but it will help. The other thing I want to do, and I can't tell you how distressed I get when I go to conferences and I hear people talk about the toxic health system, the toxic public health system. That distresses me. I want to stop the bullying, stop the harassment, make people feel good about working in public health. It's a fantastic opportunity to show off your skills. I know that people do the wonderful work, the doctors, nurses and others who work in our hospitals, but we've got to let them get on with it instead of having all these layers of bureaucracy. I mean, 7 layers of bureaucracy, I'm told, with the old structure, which is why I came up with my Making It Work reforms, and which is why I have already indicated that the extra layer of bureaucracy that has been planted above the LHNs will have no place if we're elected in March, at the end of this month.
Thank you. And for the last question, over there.
This is a question about mental health. Despite the rhetoric of the last many years, mental health services, and particularly community mental health services, have been decimated, if not annihilated, in certain parts of the state because of funding cutbacks and the bleeding of funding to other parts of the health services. What reassurance can you give us that money allocated to mental health will stay mental health?
Mental health is one of those issues, I agree, where there's been serious neglect or mismanagement, perhaps. There is a need for more acute care, but especially more a need for greater community-based care. Tonight I can't go to it, but there's a public meeting in my own electorate where the fight to try and restore now, not retain, restore the Cremorne Community Mental Health Service continues. Gladys Berejiklian, my neighbour, and I fought the good fight back in 2005 and staved off the relocation of those services, but I'm afraid they've started to do it. It will be reversed if I'm the Minister. And I can assure you that there will be. We have a special separate Shadow Minister for Mental Health, and there'll be policy put out in this regard in the next couple of days, and a large focus will be about restoring community mental health and particularly increasing the roles of NGOs in those services.